Okay, so then we are going to finish securing this on our splint.
It was fine for like a couple weeks now.
And then we
So if I switch them, does he have to be off for
do our vet wrap.
time before?
Um,
Alright, and I wouldn't just stop it. I'd wait it down. So then I'm gonna have it now. So maybe just like
and then once we have this all secure, then we do our stirrups again.
so every other day a week, and then every third day. Yeah, I just don't like to stop it too. Okay. And as you're weaning him down,
Okay,
you
so
might-
then we
if he gets worse, then okay.
secure our stirrups,
Okay.
keep our bandage in place.
They want to know if we can do pile surgery here. I was at AEC last night. They don't have time to do it. Well, the guy just made a decision. She told me that too.
Okay, so then that way we can keep an eye on the toes, make sure they're not swelling.
Yeah, 'cause-
And then
yeah, 'cause
in order
he's
to
not back
remove it,
before.
just like with the modified Robert Jones, you just cut straight up.
Oh my gosh.
Careful not to cut him or your splints.
Thank you.
Okay. So. All right, so we are going to get some urine from Willie via cysto. So what you want to do is hold on to the scruff, and I use my dominant arm to do it, and he lays along that, and then I grab with my weaker hand, grab the feet and kind of stretch them out. That way you can pull the legs back so they can palpate for a bladder, and also we keep the head away from where they're poking.
You can stop recording now.
Pause. There we go. Okay. We're going to do sub-Q fluids on boob today. So we have an 18 gauge needle and we're using LRS. We already fed the LRS through the line, making sure there's no air. And then carefully uncap. Just like you would give a sub-Q injection, you want to grab the skin, pull it up, make a little tent, and then go ahead and open this up. You got a nice flow here. Make sure you're not dripping out anywhere, and we'll just go ahead and we're going to give 100 mils. Okay. This is Indy. She's having some neurologic issues, but she had a hot spot on her leg that we wanted to clip up clean, and then we're going to put some ointment on it and bandage it. So we're going to finish just clipping up just the edges of it. We got most of it done already. Make sure you get your hair out of there. And then we're going to scrub it really well, clean it up really well. And then just to help with the inflammation, we're going to use a little bit of Animax on it. Seems to be really soothing, and it actually works pretty well, and then we'll just bandage this spot that's pretty inflamed. So, and then we want to check that regularly, definitely daily, keep an eye on it, make sure it's not getting infected, and then actually probably tomorrow we'll just take the bandage off and leave it off. Okay, we're going to demonstrate how to trim a dog's nails. So depending on the size of the patient, that's how you decide what size nail trimmers you're going to want to get. So for Dewey here, we're going to use the small nail trimmers because he's a small dog. With larger dogs, then you're going to want to use the bigger ones. This works for cats as well. So we're just going to start with this first paw. So he's got nice clear nails. It makes it a little bit easier for us to tell where we're trimming, but we don't want to just look at the side and say, oh, we're going to trim way up here. You want to take a little bit off at a time. So I actually start underneath here and just shave a little bit off at a time, going around the side until we start to see the quick exposed, but without cutting it and making him bleed. So we're gonna call it good there because he's getting a little bit sensitive. We can't see the quick there, but it's getting pretty close, so we'll call it good on that one. So then we'll just repeat on the other nails. Now I've made him a little bit nervous, so he might be a little bit more sensitive on these other ones, but so just continue on. And as you can see, we couldn't trim it quite as short as what we're seeing on the side over here. We just want to pay attention to what we're seeing underneath here and just take a little bit off at a time. It's nice to kind of shave it off instead of clip off a big chunk and then realize too late that you took off too much. So